Hello, I'm Dr. Richard Ganglish, and today I'm going to show you how composite filling is done. So I have the video right here, so I'm going to go ahead and start that up so I can watch along with you. Now you notice the patient here has a Q-tip in her mouth, and what that's for is a topical anesthetic, and that topical anesthetic is going to numb her gum before we give the injection. Now the injections are very important. We want to make sure that's as painless as possible. Now you notice the patient isn't flinching or grimacing at all. It's because they don't feel anything. Now technique's very important in this case. What we do is we go very, very slowly. And if you try to pump that in a little bit too quick, what happens is the patient feels it, and we don't want that. That's extremely important. Most important part of the entire procedure is to make sure that it's totally pain-free. So you notice how slow that is. Takes a lot of time, but it's well worth it. She didn't feel a thing. So let's get started here. We have decay that's in between the teeth. So unfortunately that means that we have to go ahead and drill down through the chewing surface to get to that. I'll use a high-speed handpiece with a very small burr. Try to keep that as conservative as we can. We don't want to take any more tooth structure away than we have to get to the decay. So we clean that up. We've got a real good water spray to keep that clean and keep that cool. So we'll go ahead and clean that up. Now we're going to use a slower handpiece now, and this will have a small rotating burr that will go ahead and clean the rest of the decay out. Got to make sure all that is cleaned up before we put a filling in. Don't want to leave any decay in. So we're going to go ahead and clean that out one more time, and now we're going to go ahead and show you what a cavity preparation is right there. Notice how we try to keep that as small as possible. Now we have a little metal matrix that we're going to go ahead and put in between the teeth, and that will confine the composite material that we're going to place in there. Keeps it from oozing all over when we try to go ahead and put that in. So at this point we're going to put a bonding agent in. Now the bonding agent has some etchant with it, and we go ahead and etch the tooth, and it also has a liquid plastic, and that liquid plastic is going to flow into those little etched areas, and it'll harden when we put the light on, and that's actually what the bond is. That's what bonds it to the tooth. And there's also a desensitizing agent. That desensitizer is very helpful because a lot of times after fillings they can be quite sensitive, so we want to do everything we can to make things easy for people. Now the filling material is a composite resin. What that is microscopic quartz crystals, and those are bound together by an organic resin, and that ends up looking just like tooth, so that makes it real nice. Now the material is light cured, so what that means is that we take an intense light that you see there, and we put it right over the top, and that causes that material to harden. Works out great. So now we go ahead and place the composite filling material incrementally. That way we don't overstep our bounds with what the light source can get to, and we go ahead and make sure every layer is properly cured. Takes a little more time, but it's well worth the effort, and you get a good filling at the end, which is important. Cure that again. We kind of shortened that a little bit so you didn't get too bored watching that. So time to take all the hardware off. Things coming along quite well so far. We'll go ahead and there's a little wedge to take out. Now we're going to take the metal matrix out. You notice it's going to take a little tug to get that out of there. It's important because we want to have good contact between the teeth, and that keeps food from getting caught in there. Now we'll go ahead and contour the chewing surfaces. We've got to make sure that those mimic nature. We want to be able to make them the same contour as the original tooth. It's very important that when you chew on a new filling that's in harmony with the rest of your teeth. So that's what we do here. So we'll go ahead and take the rubber dam out of the way so we're able to check the bite. And we'll clean up a little bit from underneath that rubber dam there. Now we have material called articulating paper. That's kind of like typewriter ribbon. We're able to see any high spots that are hitting a little bit heavy. And that looks pretty good there. So now we're going to go ahead and contour the rest of the filling. And that's looking pretty good at this point. We've got all the flash off the areas. And we want to make sure there's no sharp areas that are left. Now we'll check with floss. Got to make sure that we don't give the patient an excuse not to floss, so that's important. So we clean it up, and believe it or not, that is all it takes to get a nice, beautiful new filling, and that should give the patient many, many years of service. And so we all tend to get cavities at times, so if you happen to be next in line to get a cavity filled, now you know there's nothing to get nervous about.